Hey everybody, welcome to Healing Touch Home Healthcare. We are so glad that you have chosen to work for our agency. This slideshow shows the basic things that you need to know to be successful at Healing Touch. If you have questions, please write them down so you can ask them once this presentation is completed. Our mission is to provide professional, courteous, safe, and compassionate care to individuals while maintaining their independence and quality of life. We would like to be known and valued for providing the highest standard of in-home care customer service. We would like to be the provider of choice for in-home healthcare in our community, and our goal is to be able to work with and for others who share our compassion in providing home health services. These are the types of care and services provided by our agency. We have skilled services, which include nursing, physical therapy, occupational therapy, speech therapy, and social work. We also have non-skilled services, which include home health aid, personal care, homemaking, medication reminders. We also have cleaning services, and we provide companionship. This is our chain of command. The office staff is located at the bottom because we want to be the support structure for field employees. We want to be here to help you with whatever you need. Then the RN case managers fall above us to support the LPNs and the home health aides. HIPAA. We are here to help our clients maintain the lifestyle that is appropriate to their needs. Any information we maintain is to be held in the strictest confidence. It's considered a serious violation to discuss confidential information about a client with anyone not directly involved in the care of that client. This is the LPN job description. The LPN performs skilled nursing functions in accordance with all federal, state, and local laws and within their assigned scope of practice. All functions shall be performed in accordance with the established policies and practices of the agency and the State Nurse Practice Act. The LPN delivers care to clients as delegated by the RN case manager in the care plan for their assigned clients. This is the RN job description. The RN is to provide direct care and case management for a team of agency clients in accordance with the Ohio Nurse Practice Act and the agency policy. They develop care plans, including skilled and non-skilled interventions that are applicable to client need. They direct assigned team members, including shift RNs, visiting LPNs, shift LPNs, home health aides, and personal care assistants. Contact information. Open communication must be maintained in a home health environment. We need to hear from you, and you need to hear from us. If your phone number is no longer in service, please contact the office with a new number or an emergency contact number so we can contact you if we need to within 24 hours of the other line being inactive. Good contact information includes a phone number, a street address, we can send your W-2 to your address, an email address, and an emergency contact that we can contact if your phone number is out of service. Our dress code is pretty lenient. Professional and modest are the key two factors of our dress code. Employees are expected to wear scrubs or professional attire that is clean and properly fitted. Shoes must be closed toe, clean and in good repair. And we recommend that tattoos be concealed or covered at all times during your shift. Lunch breaks and breaks in general. You should always bring a prepared lunch with you for long shifts. An example of a good lunch would be a sandwich, like a peanut butter and jelly sandwich, chips, carrots, applesauce, water bottle, and a treat like a little Debbie snack. Anything is fine as long as it is prepared and ready to eat. Do not expect to use your client's microwave or their refrigerator. They may not have one or they may not feel comfortable having you use it. Always ask prior to using things that belong to your client. If you were to microwave some soup or stick your lunch in their fridge, make sure that you ask prior to doing so. Always bring snacks you can eat throughout your shift, like pretzels, mints, peanuts, anything to keep your sugar up. And bring a refillable water bottle or bottled drinks for your shift. Make sure you always stay hydrated. Our expectations of you. Please do not make personal phone calls, send text messages, or attend to personal business while on the clock serving your clients. We expect our employees to be flexible. Home health hours change frequently, so you must be willing to adapt. We expect our employees to have good communication skills, effective interactions with clients and staff. We expect our employees to have good client relations, a competent assessment of our clients' needs. We expect our employees to be professional in all aspects, character, spirit, and practice. We expect our employees to be punctual. Being reasonably early is better than being late. And lastly, we expect our employees to have a good attitude. Have a positive vision of your life and for others around you. Quality assurance and your role. Go above and beyond the tasks at hand to show that you care about your client's well-being. Some examples we can do as nurses are to take out the trash, to provide education on new medications, and show care in the interest of the client. Ask about their last doctor's appointment or their grandchildren. Build that relationship with them. Again, our goal is to exceed our clients' expectations. When you do exceed your clients' expectations, we send out postcards that look something like this. So please be looking for those in the mail. If you receive 3 postcards in the mail, you can redeem them for a $15 Speedway card, a Kroger gift card, a Walmart gift card. But just please call us and let us know that you're coming with your cards so we can make sure we have what you want in stock here at the office. Professionalism. You should always be friendly and courteous. Conversation with visitors and families should be always kept on a professional level. Don't bring your family issues or personal drama to work, and don't take your work home to your friends and your family. Disclosure of wages with other employees or clients will lead to disciplinary action, so please keep that information to yourself. Your role in safety. Safe working conditions and safe practices in performing duties are of prime importance to all personnel. Don't be careless and don't take chances or risks. If there is any question in what you're doing, if it's safe or not safe, do not do it. If you notice a questionable or dangerous condition, please report it immediately. Ensure your client is left in a safe environment. And do not bring anything into the home that could cause permanent damage to yourself or the client. If you are ever in an unsafe situation, please go to a safe place, either outside, in your car, down the street, and call the police and the office for more instruction. If you're in a life-threatening situation, please get out and call the police immediately. Ethical issues, tips, and gifts. It's a policy of the company that employees are not to accept cash or gifts from clients or families for the services rendered. This will result in termination if the employee is found to have violated this policy. Please do not buy anything for your clients with your own money. This includes co-payments for medications, anything. Do not buy things for the clients. McDonald's on your way to your shift. Have them pay for these things themselves. How to politely refuse tips or gifts. When offered a tip or gift, please respond with something nice like
Per agency policy, I'm not allowed to accept gifts from clients I serve, but the gesture is greatly appreciated. It means a lot. Homemade food is kind of a different situation. So if a client offers you something they have made for you, like a slice of pumpkin bread or cookies, we as an agency do not have an issue with you consuming food that has been offered to you. We don't wish to offend our clients, but we also want to be careful not to take advantage of them. Exploitation is a serious thing, and we're going to talk about that in a later slide. Please use your best judgment, but if you have any questions, we're always just one phone call or text away.
Client rights. A disability does not diminish an individual's rights. There are 24 rights that I'm going to read, and these rights are really important for our clients with disabilities. Everyone has the right to be treated at all times with courtesy and respect, and with full recognition of their dignity and individuality. They have the right to have a safe, clean place to live in and a place to be alone. They have the right to have food that is good for them. They have the right to go, if he or she wants to any church, temple, or mosque. They have the right to go to a doctor or a dentist when they are sick. They have the right to have people help them with the way they walk, talk, or does things with their hands, acts, or feels if they need the assistance. They have the right to have people help and teach them if they would like that. They have the right to have a time and a place to go be by themselves. They have the right to call, write letters, or talk to anyone they want to about anything they want to talk about. They have the right to have their own things and to be able to use them how they see fit. They have the right to have men and women as friends. They have the right to join in activities and do things that will help him or her grow to be the best person that they can be. They have the right to work and make money. They have the right to be treated like everyone else. They should never be hit, yelled at, cursed at, or called names that hurt. They're able to learn new things, make friends, and have activities to do and go out in their community. They're able to tell people what they want and be a part of making plans or decisions about their life. They're able to ask someone for help and let others know how they feel or what they want. They're able to use their own money to pay for things that they need or want with help, if help is needed. They're able to say yes and no before people talk about what they do at work or home, or if they look in their file. They're able to complain or ask for changes if they don't like something without being afraid of getting in trouble. They should not be given medicine that they don't need or held down if they are not hurting themselves or others. They're able to vote and learn about laws in their community. They're able to say yes or no to being a part of a study or experiment. Being a patient advocate. We may be able to help partner with you to advocate for your clients if they need help. Please advocate for your clients by fighting for them when they are unable to do so themselves. If they have an unsafe or inhabitable living condition, like no power or electric, no water, no food, no heat, if the client is in an unsafe living condition or there's abuse in the home, please notify the office. Screening for abuse and neglect. Please be observant for physical abuse. It could be in the form of bruising or bleeding. Be observant for emotional abuse. It could be a sudden change in behavior. Please be observant for sexual abuse. If you see any coercion. Please be observant for financial abuse, any misuse of assets. And lastly, be observant for neglect. Families showing little or no concern for the family member or our client. Notify the office during business hours if you see any of these warning signs. Even if it's after hours, please call either the office number and leave a message or the RN case manager on the case if it needs to be addressed immediately. Advanced directives, DNR statuses, and death and dying. DNR stands for do not resuscitate. You'll be notified before you enter a client's home if a client has a DNR request. The form is listed on the slide so you can see what that looks like. A DNR with their doctor's signature will be given to you for use in emergency cases. It's to be given to the emergency care providers, the EMTs, paramedics, when they arrive to the home. If you are in a life-saving situation, please call 911 and then begin providing CPR immediately if you are alone. Notifying the office for major unusual incidences. An MUI is an alleged, suspected, or actual occurrence of an incident when there is reason to believe the health and safety of an individual may be adversely affected and the individual may be placed at a reasonable risk of harm. These are the types of MUIs that are tracked by our agency and the state. So please be aware of these MUIs. If a client attempts suicide, if there is known injury, if law enforcement had been at the home, if there had been a medical emergency, an unscheduled hospitalization, abuse, death, exploitation. These are more like gifts. If some client gifts something to someone, a computer, money. If you fail to report an incident, it's an MUI. Misappropriation is theft. A missing individual or missed visit. Neglect. Peer-to-peer acts. Prohibited sexual relations. A rights code violation. Unapproved behavior support. An unknown injury. And any incident that needs to be reported to the director of the agency. Please report any of these things immediately because we have very limited time to notify the state of these situations. An unusual incident includes but is not limited to medication errors, falls, peer-to-peer incidences that are not MUIs, an overnight relocation of an individual due to fire, natural disaster, or mechanical failure, or any injury to an individual that is not an MUI. Please notify any unusual incidences immediately as well. We have a little bit more time to notify the state, but it is still in a timeline, so please notify us as soon as you know about any of these things. It's good to understand that if we have not notified you of these MUIs, then we might not be aware of these in the office. So it's always best to double notify. If we know already, that's fine. Please notify us again. Client hospitalizations. You're required to contact the office as soon as you know that your client is going to the hospital or has been admitted to the hospital. Please be prepared to answer these 3 questions: why your client went to the hospital, when they went, and what hospital they went to. When your client is discharged from the hospital, please make the office aware as soon as you know. If you don't report the hospitalization or discharge, you may be subject to disciplinary action, so please keep us informed. If we haven't notified you, we probably don't know. So please call us to make sure that we're on the same page.
What if my patient has to go to the ER or has a procedure scheduled? Please clock out of your shift if your client has been taken by squad to the ER or hospital. And please clock out of your shift if your client has been admitted to the ER and or to the hospital. Remember, you must be with your client in order to provide services, and we must be the only provider billing for said services. So if your client is in the care of the ER staff, we can no longer bill for hours provided. Pain and pain management. As a nurse, we will be assessing pain. To have a complete pain assessment, we must gather the following information: the origin, the location, the duration of the pain, the intensity of the pain, and treatment that helps the patient. This is an example of that assessment completed. Think of both pharmacological and non-pharmacological interventions to provide relief to your clients. The example above states that a heating pad helps that nerve pain. So that would be a good example for that patient. It could be an ice pack, it could be repositioning, it could be that pain medication that they have prescribed, but we need to explore all avenues to help that patient.
Your role in preventing infection. You can reduce the risk of infections developing and spreading by using standard precautions, meaning that you wash your hands before and after everything, wash your clients' hands before they eat, after they use the restroom, and anytime they need it, and use gloves whenever coming in contact with any bodily fluid. You may also be using contact isolation. This is used in cases of C. diff, MRSA, or lice. It requires a gown and gloves, in addition to hand washing when providing patient care. Remember, clean up after yourself and the client. Don't leave any food out for critters. Keep their home clean, dust, vacuum, and wipe down countertops. Waste management. Make sure that the clients are clean and dry when you arrive and depart, and as needed during your shift. If your client uses a bedside commode, make sure it's empty and clean when you arrive and before you leave their residence. It also helps if you add 1/4 cup of Lysol into an empty commode. It helps to keep the odors down. Ensure that any bodily waste is removed from the home entirely. Take it to the garbage outside of the home after your shift. We provide PPE in the office. We have gloves and hand sanitizer that are available for you at the front desk. If you need additional supplies like masks, gowns, or booties, please request those. Some of them may have to be ordered if we don't have them in stock. Care of equipment. Please be cautious and courteous of all medical equipment in your client's home. Most of this equipment is given once, or it isn't available for replacement for up to 5 years. For example, if they have a hospital bed, it is probably the only hospital bed that will be covered by insurance for their lifetime. If they have a wheelchair, that wheelchair may be able to be replaced after 5 years. But we want to make sure these are respected to the utmost level. If you have any questions about using the equipment, please call our office and we'll do the best to give you hands-on training at the office, or we'll call the DME supplier and have them fix equipment that is broken or provide training if necessary. BCI and FBI standards. The federal guidelines that are applied at hire should be maintained while you are employed at Healing Touch. If you have convictions at your date of hire, we may be able to work with you in your rehabilitation process if you are open and honest about your situation. If you are not open and honest about your situation and lie on your application, we will have to terminate you once we receive your BCI. We expect our employees to obey traffic instructions and follow laws and regulations of our local and federal governments.
How do I keep my nursing license valid? To keep your nursing license valid, our state requires 24 hours of CEUs every 2 years. We may provide an occasional CEU in the office. We'll definitely advertise it and let you know about that event, but they're also available online. You can complete all 24 CEUs at NetCE for $20 to $25, at Elite CE for $24.95, and CEU Fast for $30. For that, everything is all together the Ohio law CEU is always included. To renew licenses, RNs renew their licenses on the odd years, so they will renew in 2017 and 2019 and etc. And the LPNs will renew in the even years, 2016, 2018 and etc.
These are the scheduling basics. If you're looking for hours, our scheduler is your new best friend. When we get referrals for new clients, it's our job to find appropriate staff for the client's needs. We call, we text, and we email all of these cases out to you. Most of these cases are first come, first serve, so please let us know as soon as possible that you are interested. When you're given a case, it comes with a specific time. It's important that you go to the client for the times you were given. Otherwise, we run into some issues. If you're going to be late, if you are going to your shift early, if you're not going at all, please let us know as soon as you find out this change. Any change in schedule must be approved through the office. That's why we request that you call us as soon as you know. Referral guidelines. If you know of a client in need of home health services, contact our office and let us know. We'll be more than happy to help them with their skilled or non-skilled needs. If you would like to be assigned to this case, let us know and we can usually work this out for you. Frequently asked questions about shifts. The first question is, what if I'm going to be late? If you're going to be late, please call the office, even if you're going to be just a couple minutes late. We will contact the client for you to let them have an update, and you can generally make up that time at the end of your shift. If you're 5 minutes late, you show up at 1:05. You can typically work, if it's a 2-hour shift, until 3:05. Please make sure your timesheet reflects the exact time that you were there working. What if my client isn't home? If your client isn't home, please call the office at the beginning of your shift. If you are scheduled to be there at 1, you arrive at 1 and your client's not home, call us at 1 so we can call your client. We might have to call hospitals to find your client, call their emergency contact, and we ask that you wait 15 minutes before leaving so that your client can come home and you can work your shift. Your client must be at home in order for you to provide services. What if the weather is bad? Even if the weather is bad, you're expected to go to your client's home unless there's a level 3 snow emergency for your county or your client's county.
What if I can't go to my client's house? Call your client and ask if they would like a fill-in for your scheduled shift. We recommend making this phone call at least 6 hours prior to your start shift time, and if you can give a full day notice, that's always best. If no, the client does not want to fill in during your scheduled shift, notify the office at least 4 hours prior to the beginning of your shift. The office will call your client and verify they refused that fill-in service and will cancel that shift and notify the case manager that is assigned to the patient. If yes, your client would like a fill-in, please call other nurses that are assigned on your care team. That care team is located on the patient's face sheet, and you can see other nurses that are assigned to your patient, and we can work as a team for that patient to trade hours to make sure that client has their needs met. If a member on the care team is able to fill in, please contact the office to make sure that we are aware of the schedule change as soon as possible, but at least 4 hours prior to your shift. If there is no care team member available, please notify the office, and we will call other staff members that may be available to fill in and help out with your patient. The more notice, the better. If you do a fill-in for someone else, you do get an extra $1 per hour, but make sure you're coding that correctly on the portal or on a paper timesheet. Another reminder, you must be with your client to provide services.
Paychecks. Payday, you'll receive your paycheck on a weekly basis. Your check will be deposited into your bank account every Monday, unless we tell you otherwise. If Monday is a holiday, your direct deposit will be early. We require direct deposit, so please bring us a blank check or fill out a direct deposit form. Make sure all your paperwork is correct and turned in by Monday at 1 for them to be processed. That includes submitting timesheets on the portal. Please make sure they are all submitted and processed on Sunday so they're pulled on Monday morning. If there is an error in your pay, please notify the office for appropriate instructions. If your timesheet is stuck on the portal incomplete, we may have to have you fix that in order to pay you for that timesheet. If it was a mistake that you made, the error will be fixed on your next paycheck. For all other errors, they'll be fixed as soon as possible, but at the latest, they'll be on your next paycheck. Write-ups are our form of discipline at Healing Touch. We really do not like to write them. We do not like to give them. You don't like getting them, so let's try to do our best to follow policies. This written counseling gives you the opportunity to correct any behaviors that violate our policies. This provides an opportunity to meet with you to correct any misunderstandings or misconceptions. The first offense is a written warning. The second offense is the final written warning. And the third time is termination. If you receive a write-up within your first 90 days of employment during orientation, for serious misconduct, you will be terminated automatically. We do conduct random drug testing. If you refuse to go to the random drug test or have a positive result, it will result in termination. Resignation. If you decide you don't want to work with us anymore, please give us a 2-week written notice so we can ensure the clients receive the services they need until a replacement can be found. Please turn this in to the front desk or email it to us in writing, and the 2-week period begins the day our office receives your notice. If you're giving up a client, we do ask for that 2-week notice as well. You're required to go to your client for those 2 weeks to allow our scheduler to restaff and in some cases rehire staff for your case. Our resignation policy states if you do not give the required 2-week written notice, we can pay your last check at minimum wage. So please follow the policy of giving that 2-week written notice so our clients aren't suffering, and we will give you your normal pay. We have an open door policy at Healing Touch. If you have an issue with another employee, a supervisor, or manager, you may seek assistance with the problem through the open door policy. We have an open door policy to resolve issues so that we can maintain a constructive working relationship with you. If you feel as if your needs are not being met, please ask to speak with another office employee until you feel like your needs have been communicated effectively and the situation has been corrected or properly adjusted. Our on-call phone. We're available for you in the office Monday through Friday, 8:30 a.m. to 4:30 p.m. But if you need us outside office hours, you can still call our main phone number, which is 937-610-5555 at any time of the day. And if it's after hours, it will be forwarded to our on-call phone. We have an on-call phone that you can call or text. That number is 937-272-5553. And we also have a Google Voice account that you can text. That number is 937-541-0090. Please write these numbers down so you can contact us whenever you need us. You can still contact us for limited information after hours by using these 3 numbers. To contact an office staff member after office hours, please call and leave a message for us, and we will get back to you. Why should I call the on-call phone? Reasons to call the on-call phone is to call with fill-in replacement information, to call because your client has an MUI, UI that needs to be reported, or a client update. However, if you or your client is experiencing an emergency, please call 911. When you leave a message on the on-call phone number, please be patient with us. We will return your call as soon as we can, hopefully within 1 hour. If your message cannot be handled outside business hours, we will return your voicemail during the next business day. Reasons to not call and wait until the next business day is if you're requesting a permanent schedule change. We have to be here in our systems to change that. If you have a payroll question, we again have to be here to sign into those systems to show you and answer your questions on payroll. And if you're giving up a client, you can do this via email, or you can give a written notice in the office during business hours.
Oxygen safety. Many of the centennial events reported by home care programs to the Joint Commission were due to a fire in the patient's home. In each case, when a patient was injured or killed as a result of the home fire, home oxygen was always in use. So oxygen is a really big deal. There are 3 steps to oxygen safety in the home. The first step is to conduct a safety risk assessment on patients consuming oxygen before each shift. This includes looking around to see if there are any smoking materials in the home, any cigarettes, lighters, pipes. Are there any other fire safety risks in the home? A burning candle, a gas fireplace, a gas stove? Does the family have working smoke detectors in their home? Does the family have a propane or gas stove? Remember, we should always think and be safe. The CPSC's National Electronic Injury Surveillance System conducted a study in 2008 in regards to what is causing oxygen-related burns seen at hospital emergency rooms, and by far smoking materials outweigh the rest. So you're always looking for those cigarettes and lighters around the home, because that is the largest factor that caused those ER visits. Step 2, we want to inform and educate the patient and caregiver on the risks of oxygen-induced fires. Every day, over 300 children ages 0 to 19 are treated in emergency rooms for burn-related injuries, and 2 of these children die every day as a result of being burned. Normally, air has 21% oxygen. Increased oxygen makes oxygen more available for the chemical reaction, meaning that any fire that occurs will burn faster and hotter. Increased oxygen also lowers the temperature at which things will ignite. This includes hair, clothing, plastic, skin oils, furniture, and any other items. Oxygen safety tips for clients. Never smoke in a home where oxygen is used. Post no smoking signs in and outside of the home to remind residents and guests not to smoke. If oxygen is used in the home, the amount of oxygen in the air, furniture, clothing, hair, and bedding go up, making it easier for a fire to start and to spread. This means that there is a higher risk of both fires and burns. Never use an open flame, like candles, matches, wood stoves, or sparking toys, when oxygen is in use. People who may have difficulty escaping from a fire should have a phone near their bed or chair. Make sure that the home has smoke alarms or smoke detectors, and test them at least every month. Have a fire escape plan with 2 ways out of every room and an outside meeting place. and practice this plan at least twice a year. The last step is to assess the patient's level of comprehension and compliance with the education provided. Is the family continuing to smoke or burn candles in the home? Is the client refraining from using any potential for flame? Make suggestions on how to enhance smells in the home if they want to use candles. They can use a candle warmer or furnace filter air fresheners that go right on the air filter. If you are ever put in a high-risk fire safety situation, please speak up and get out. Please call the office to let us know, but your safety is more important to us than this risk.
This is the hand washing competency form. It's found in your paperwork. Please locate that form because we're going to fill this form out together during this slideshow. You need to put your name at the top of the sheet where it says name. And we're going to answer these 6 questions on the form right now. So please look at that section.
The first question is, when should you wash your hands? There are many correct answers to this question, and any of these answers will do. Before, during, and after food preparation, before eating food, before and after caring for someone who is sick, before and after treating a cut or wound, after using the toilet, after changing diapers or cleaning up a child who has used the toilet, after blowing your nose, coughing, or sneezing, after touching an animal, animal feed, or animal waste, after handling pet food or pet treats, and after touching the garbage. The second question is, how long should you wash your hands? CDC states that you should scrub your hands for at least 20 seconds. If you need a timer, hum the happy birthday song from beginning to end twice. And again, that's it, 20 seconds. The third question is, what is the first defense that your body has against an infection? By far, our best defense is our skin. Intact skin is the largest organ of our body that protects infection from getting into our organs. There are other defenses that our body has that are also helpful to protect us against infection, and they include cilia, stomach acid, urine flow, friendly bacteria, and neutrophils. The fourth question, what is the #1 defense we can do to prevent an infection? The best thing we can do is wash our hands. The fifth question on your form is, how many times should we use hand sanitizer before hand washing is required? This answer varies by location, but in home health, you can use hand sanitizer up to 5 times because you are with your client in their environment. In an acute setting like an ER or inpatient hospital, they suggest only using hand sanitizer once between washing with soap and water. In a long-term facility, they say twice. But best practice is to always wash your hands with soap and water. The 6th question on your form is, what else can we use for infection control besides hand washing? Any PPE, any gloves, gown, masks, eye pro, or face shields. Personal protective equipment is the best thing that we can use besides hand washing. This is the waived testing form that should be located in your paperwork. Please grab that and we will fill this out together. The first thing I need you to do is to put your name at the top of the paper. Then we're going to answer these 5 questions. The first question on the wave testing form is how often should monitor controls be completed? The answers are when a machine is dropped, when a result is questioned, when a new batch of strips is open, or all of the above. The correct answer to question number 1 is D, all of the above. The second question on the wave testing form is a patient's physician should be called for glucose level of what? The options are 40 milligrams per deciliter or less, 400 or greater, 60 or less on a repeated glucose after treating with glucose for hypoglycemia, or all of the above. The correct answer for number 2 is all of the above. The third question on the wave testing form is which of the following is not true concerning the collection of a fingerstick blood specimen for glucose testing? So you're looking for the false statement in the letters below. Letter A, if the patient's finger touches the pad of the strip, it must be discarded. B, it's best to pierce the side of the finger, of the middle or ring finger. C, excessive squeezing of the finger may result in an inaccurate glucose reading. Or D, not letting the alcohol dry on the finger may result in a falsely decreased result. The correct false statement listed here is A. If the finger touches the pad of the strip, you can still use that strip. B, C, and D are all true. The fourth question on the wave testing form is when your patient is ordered a sliding scale, where can you find this sliding scale? This is an agency-specific place, that's why this is a question on our test. You can find the sliding scale on the med list on the special instructions. So please be looking on the med list, special instructions for that sliding scale. The last question for wave testing is when should glucose tests be conducted? The answers are ACNHS, per doctor's orders, BID, or daily. Since every patient is different, the answer is B, per doctor's orders. This is our blood sugar record form. This is where you will document those sugar readings. You'll start by filling out the top. My example says poly patient. Date of birth 1/6/55 is ordered glucose every day, and the week ending currently is 7/23/16. I'll then put my name where it says employee name print and my initials. I will then document the date, the blood sugar reading that I got that day, how many units of insulin I gave, and then a check under C. The key at the top says that A is no action, B, we did hypoglycemic protocol, C, insulin given, or D, physician notified due to out of range. So because the 225 is within a normal range for this patient, I gave 12 units per the sliding scale. I check C. I then put my initials on the far right of the form, and then I complete the calibration date. It was last calibrated on 7/1/16. Many meters are now electronically checked and do not require a manual high-low evaluation. Just complete the form per the meter. Vital signs. Vital signs should be offered to every patient at every visit or shift. That means sometimes we're offering vitals 4 times a day. Patient and guardian always have the right to refuse vitals. Vitals in home health include temperature, weight, blood pressure, respiration rate, and heart rate. The paper timesheet has a box that looks like this that needs to be completed. And on the portal, it looks like this. Wound care. Wound care forms should be completed every week, usually on the first visit of the week. The wound care form includes a wound assessment, a Braden scale, and nursing interventions to prevent ulcer development. Submit this form weekly with your timesheets. In providing wound care, make sure we're following the detailed wound care orders listed in the intervention section of your 485 or on your timesheet. If orders need to be adjusted because the doctor made a change overnight, please call the office to reflect new or changed doctor's orders. This is the wound care assessment tool. You'll need to complete this form by putting the patient name at the top of the form and completing the wounds appropriately. So wound number 1 for Patty patient is on her abdomen. It is a surgical wound that is measuring 3 centimeters by 2 centimeters by 0.5 centimeters. And you can read down the list. The wound bed is pink. There is no drainage. There is no tunneling. Surrounding tissue is appropriate. No edema, no stoma. It is fully granulating. The wound care orders are on the 485 or physician order. No return demo available, and the patient response was good. You will then sign and date the assessment. This is the second page of the wound care assessment tool. A Braden scale, located at the top of the form, is a tool to predict the risk of pressure ulcers. There are 6 criteria within the scale, including sensory perception, moisture, activity, mobility, nutrition, and friction and shear. On the right, you can see that this has been completed with a score of 23. The scoring risk for a pressure ulcer is listed here. 9 or less is a very high risk, all the way to 19 to 23, which is no risk. Based on your score, you may want to use the intervention instruction guide on the bottom half of this sheet that will give you some options, some interventions for nursing to prevent that risk of pressure ulcers. The paper timesheet is only to be used if the portal is down or disabled. Documentation must be 100% complete in order to receive payment for that timesheet. All paperwork is due by Monday at 1 p.m. You can submit your timesheets as soon as your week is completed. You can submit timesheets on Friday evening, Saturday all day, Sunday all day, and Monday up until 1 p.m. All skilled nursing interventions are listed on your timesheet. Example of your timesheet would be medication management, and you would check off the things that were completed during your shift. Medication planner was pre-filled. The same assigned skilled nursing interventions are listed on step 2 of your portal. This is our skilled nursing assessment that used to be completed on paper. However, we have moved to the electronic portal. This can be used if the portal is down. In order to process these paper timesheets, we need the following information. You should always be using an updated timesheet that was printed within the last month. This timesheet was printed in May of 2014, so it's very outdated. It would not be accepted. You should always check to make sure that it is printed with the same month and year you are completing that timesheet. You will then complete the date of service, an exact clock in and clock out time, the client signature and date, Select which form of visit is being completed, a routine skilled nursing shift, visit, or a fill-in visit or shift. Complete the 10-box assessment, head-to-toe assessment, including pain, cardiovascular, respiratory, head, eyes, ears, nose, throat, vitals, musculoskeletal, GI, urinary, skin, and neurological. Then address each nursing intervention that is ordered for your patient. Please check the box that it was completed and write NA if it's not applicable to that shift. Summarize the visit. Patient tolerated well, no complaints at this time. Please make sure that you're writing clearly and legibly. You will then review the medications and complete a falls assessment. Report any new medications to the office immediately and ask the client if they've had any falls since the agency last visited them. You will then sign and date. Next, I'm going to show you how to submit timesheets through our agency. We have developed an online portal that you can use to submit your documentation to the office without having to come to the office every week. So if you can take out a smart device that you have with you, an iPhone, a Galaxy, it doesn't really matter what smartphone you're using, or an iPad would also work. You'll want to you can use your data. It doesn't use very much data to do this, or you can connect to the internet here at the office. Either way is fine. So we're going to open up our web browser and we're going to log into the employee portal. So please go to www.htemployee.com. It's also really smart to save this as a bookmark in your phone. And someone should have handed you a Post-it note with your username and your password. So please plug in your username. It should be a series of numbers. And your password is your birthday, month, and day. So please enter in your username and password and press sign in. And it will take you to your home screen. And I'm doing this with you so I know how long to wait for your phone to load. So my phone is currently loading the employee portal. Your home screen will look like this. It will say welcome and your name. It will have messages. If you have messages, you won't have any right now. So don't be confused if you don't have any messages at the moment. It will also show you any not submitted timesheets if they're not complete or missing some documentation. They will also be listed on your home screen, and you can also create your timesheets from your home screen. You have a menu at the top of your phone that says timesheets, and there's also 3 lines on the right of your screen, and this is how you maneuver your way through the portal. If you click on timesheets, you'll be able to see not submitted and submitted timesheets, so you can see all the documentation that you have already submitted to the office for payroll. If you want to edit your not submitted timesheets, you can either edit it on your home screen, or you can edit or add options by going to your not submitted timesheets section. The submenus, not submitted timesheets and submitted timesheets, will look like this. The not submitted timesheet section will allow you to edit step 2, step 3 of your timesheet. It will allow you to submit your timesheet. You can view or edit the timesheet. You can add a clinical note, or you can remove it if it was created in error. Your submitted timesheets will list submitted timesheets there with the confirmation verification number, and it will also provide you a viewing option. Once you have so many timesheets, your submitted timesheets will then apply a filter for you to view certain weeks or days. Back on your home screen, this is where you can edit your timesheets as well. It only gives you a few options. You can add your clinical note, you can delete it, or you can submit it to the office via your home screen. To create a new timesheet, you would go down to the green box on your phone, use the drop-down section, and you will see a test patient. Please select that test patient and press Create Timesheet. If your patient that you have assigned from the office is not listed here under Create Timesheets, please let us know. That means that patient has not been assigned to you in our system, and we need to update that for you. Step 1 of our timesheet is our head-to-toe assessment. You will start your timesheet by selecting a routine or fill-in visit and your time in, and then you'll complete the 10 assessment sections. You'll assess pain, vitals, GI, urinary, skin, cardiovascular, respiratory, neurological, musculoskeletal, and head, eyes, ears, nose, throat. There is a within normal limits section in each category, and also denies for pain. The patient can refuse vitals. That is also a box that can be checked. So go ahead and fill this section out. You can make it a routine skilled nursing shift. Put your time in as when you started orientation. Typically that's 10 o'clock in the morning. And fill out this portion of the timesheet. Pain, you can say denies. You can write in that assessment if you choose to. For vitals, you can write in your vitals or press refused. And to save time, we're just going to press within normal limits for the rest of the categories. And then you're going to go to step 2. So I'll wait a few seconds for you to finish checking within normal limits on this page. All right, step 2 of your timesheet consists of the ordered skilled nursing interventions from your plan of care. There are 3 options for each intervention. You have a pending remind me later option, the ordered intervention, and freehand text. Select pending if you have not yet completed that intervention during your shift, so it will come up later. And pending interventions remind you to complete that charting before submitting it to the office. If you need to chart on an item more than once during your shift, you can check the box for pending, which will remind you to chart later. You can check the intervention because you partially completed that intervention, and you can write in the freehand text area. Please be as specific as possible in this documentation. If an intervention does not apply, please write why it does not apply in the freehand text section. You can see on the right, O2 saturation was 98%. The next intervention says to notify doctor when O2 saturation is less than 90. We are not going to check that box because we did not notify the physician. Instead, we're going to write in the freehand text section stating not applicable, O2 remained above 96% the entire shift. Step 3 consists of 4 different tasks. The first task is the medication review. So we're going to look at all of our patients' medication, the strength and dose, the frequency and route, and make sure that this is accurate information. If there haven't been any med changes for your patient, you're going to check no changes. However, if your patient has a new medication prescribed or one of the current medications listed is not correct, you can press New Order Office Notified, and it will pop up a little screen letting you know how to document a med change. Please send the medication name, strength, dose, frequency, route, doctor, the start date, and any special instructions for that medication. We will then receive that in the office and update the client chart. Again, medication updates must include the following: the medication name, strength, dose, frequency, route, the doctor that ordered the medication, the start date and end date if you know. For an example, an antibiotic would have a 5-day or 10-day duration, and any special instructions for that medication. All as needed medications must have an indication. So Tylenol, 325 milligrams, 1 tab every 6 hours, PO from Dr. Waite with a start date of 10/16, and it is as needed for pain. Discontinued medications can also be listed in the medication change box. Please include an end date for the medication. Step 2 is a fall review. We want to ask our clients if they'd had a fall since our last visit. If they have not had a fall, you can write none reported, check that bubble. If they have had a fall, please select yes, office notified, and another drop-down box will appear asking you for more details. The date of the fall, type of injury, if there is one, who it was observed or reported by, who we notified, usually the physician or the state case manager, and any comments. When you fill out this section and submit it, it will be sent directly to clinical office staff, and they will update the client's chart and report to the necessary individuals. This is a close-up of the fall documentation, and this is how you would fill it out. 7/29/2016 was the fall. The client did go to the ER. It was reported by the patient, and we reported it to physician Dr. Waite on 7/29/16. Please include any special instructions in the comment section or in the clinical note of your timesheet regarding this fall. Instructions on how to access the clinical note section is coming up later in this presentation. If using paper timesheets, you need to call or text the office immediately if you witness or are informed of a fall. Step 3 consists of your time out. So please select the date and time out of your service. And the last step of part 3 or page 3 is your signatures. The employee and the patient can sign on your phone in those sections. And then you will press finish, all done. Some of our employees are uncomfortable with our clients holding their phones, so there's also a handwritten signature option. It is a form called the Nursing Weekly Timesheet. This will have to be submitted by 1 on Mondays in order to be processed for the previous week. So please make sure you turn that in completed. It does require a client signature, an employee signature, and dates next to each block. The final submission page is the next page you will see after you click on the submit on page 3. If you forgot to fill out a portion of your timesheet or pressed a pending option, you will be able to complete that intervention at this time. You can then click on submit if you don't have any errors listed for correction. If you are a shift nurse, you will need to add narrative documentation every 2 hours to your shift. So we'd go back to the home screen and add a clinical note. Clinical notes can be found in 2 places, which is kind of nice: on your home screen on not submitted timesheets, or on your menu in not submitted timesheets. So please click on the notes blue button And create your clinical note every 2 hours for your shift. Please ensure you're putting the timestamp. 8 a.m., client resting in bed, medications administered via G-tube, patient tolerated well. 10 a.m., patient awake, watching television, suction completed, patient tolerated well, are examples of the every 2 hour documentation. Once you have added that 2 hour narrative, you want to submit the timesheet, and it will say information saved successfully. And you can then submit another timesheet by going back to your home screen and selecting a different patient. Congratulations, you now know how to use our portal. I understand this is your first timesheet, but we are here to help you any time of the day or night. Just give us a call. You can call the office at 937-610-5555 and talk to office staff during office hours, or leave us a message and we will call you. A MAR is a medication administration record. MARs are due by the 5th of the following month. So for November, if you did a MAR for the month of November, it would be due in the office by December 5th. All nurses on the case should use the same MAR. It aids in communication between the staff and the family. Please follow the 8 rights of medication administration. They are the right patient, right route, right drug, right dose, right strength, right time, right documentation, and the patient's right to refuse. This is an example of a medication administration record. And you can see on here there are 2 nurses, Emily and Jessie, that worked on the 1st of July. And you can see the 8 a.m. times were initialed by Emily, and the 8 p.m. times were initialed by Jessie. Down below, make sure you initial next to your name. This is a medication list. Medication lists include important special instructions, like why a PRN medication is being administered, and a sliding scale for insulin administration. There is the sliding scale listed for you for Humalog for this patient. You should always have a med list if you are administering medication to a client. We offer training and refreshing of skills in a few different ways. We can send you out with the nurse assigned to your case to have hands-on training with your assigned patient. This is the best practice. We also can train you with an experienced nurse that's on a similar case. If your client is at Children's Hospital, we can usually arrange for you to train at Children's Hospital on that new patient. And you can also learn about that patient with the patient or caregiver of the client you have been assigned. If one of these options is best for you, please let us know and we can make that happen for you. Due to being unable to bill for training with another paid provider, we pay orientation training pay at a lower rate because we're unable to bill for any of those services provided. So if you are training with another nurse, you will be paid at $12 per hour because we're unable to bill for those hours. This is the skilled nursing training competency form. This is completed if you are training on a new case and shadowing a family member or a nurse for the case. They can sign you off stating that you are proficient in the assigned tasks. So in order for us to process your training form, the trainer must sign, you must sign. It must be dated with a clock in and clock out. Initials should be next to the interventions with check boxes stating that you are proficient, and any additional notes can be listed there as well. Please ensure you know the amount of hours you are approved to train. Most cases only need 2 to 4 hours of training, but some more extensive cases may have 12 hours of training available.
All right, go get 'em, Tiger. Now that you know what you need to know to be successful at Healing Touch, we're excited to see all the lives that will be positively affected by your servant heart and your attention to detail. We're here to support you with whatever you need, whenever you need us. An open communication between field employees and office employees really helps. The more communication, the better.